Pain during IUD insertion. Women on TikTok are posting videos of themselves going through IUD insertion and talking about the lack of pain control options in their experience. So let's get into it. An IUD is a long-acting, reversible form of contraception that is highly effective. It can come in hormone-releasing forms like the Mirena or progestin-releasing IUDs, or non-hormonal forms like the copper IUD. You can see that it's shaped like a T and sits at the top of the uterus, and you have the strings that dangle just outside the cervix in the vaginal canal. And when you're actually inserting an IUD, and I've done many of these, the arms of the T are actually straight down, and they only get released and open up to make that T once they're in the uterine cavity. Now the cervix, which is the entryway to the uterine cavity, is closed. The internal part of the cervix is physiologically closed, so you do kind of have to dilate through the canal and use a bit of pressure to push the IUD in, and then you can deploy the arms once you're at the top of the uterus. This can lead to a lot of cramping, and the experience can be different for different people. For women who have had children and they've had vaginal deliveries where the cervix was dilated, that opening is going to be larger, and that's why historically we have seen that women who have had children have a less hard time when it comes to IUD insertion and the pain associated with it. IUDs have been used for a long time, but I would say 10 to 15 years ago they were mostly used in women who have had children. And so we think that's one of the major reasons why the overall thought of how much pain is associated with insertion has been minimized and overlooked. Now that there is more awareness for the need for pain control options before, during, and after IUD insertion, we're seeing more use of methods like a paracervical block, where local anesthetic is injected on either side into the cervix, and we know that there's a network of nerves, and this can actually help to prevent and relieve a lot of the cramping pain that you can feel throughout the uterus. And even though we have some studies now that show that this can be quite effective in preventing and relieving pain, there are still some barriers to people using this. It does increase the procedure time. It's said to double the amount of time it takes, and not everyone's office is set up to have this type of anesthetic and to feel comfortable administering it. And also, not every patient is going to feel jazzed about the idea of having this needle to inject the anesthetic, even though it can help overall with pain relief. One of the most common pieces of advice that patients will get from their doctor is take some Motrin and Tylenol an hour or two before the procedure. But now we have enough studies that show that this does not really work or help. There's limited evidence on stronger pain meds like opioids, and some people think that it could be more effective, but we also have to be really sensitive to the opioid crisis. We have to be mindful of prescribing practices. Believe it or not, at one time, people thought that using misoprostol, the medication used for medical abortions because it helps to ripen and soften the cervix, they thought that this could help. But now we have good data that shows it's not really effective, and the CDC recommends against its use for the purpose of IUD insertion. A common response that I hear from women and patients when it comes to this issue is, well, why don't doctors just knock us out? Just give us sedation or general anesthesia when inserting the IUD. But anesthesia, where someone is sedated to a level where you have to protect their airway, is not something that we take lightly. It's more costly to the patient. It's logistically more challenging. You have to have someone who's trained to administer anesthesia. It requires close monitoring. You're going to need someone to pick you up from your appointment and take you home. You're going to have to take that day off of work, etc., etc. Now, of course, if you're already undergoing a GYN procedure and you're going to be sedated and have anesthesia, then it makes sense to think about asking if you can have your IUD inserted under sedation or swapped out. And obviously, there's always special cases and exceptions to the rule. In general, giving every single person who's having an IUD inserted anesthesia or sedation is not practical, and it may not be necessary. The perception of pain is a very individualized, personal thing, and it's hard to measure objectively. As patients, we need the confidence and the tools to be able to advocate and communicate our needs to our OBGYNs. And we, as OBGYNs, need to do a much better job of counseling patients on what to expect realistically and what their pain control options truly are. And most importantly, we need to listen to women.